We have a very special guest on the Flame Central podcast. As you know, it's presented by OrthoVirginia. And that means that we have to bring on one of the doctors of OrthoVirginia, David C. Landy. Dr. Landy, thank you so much for joining us today.
Thank you for having me. It's a pleasure to join.
Okay, so Dr. Landy, I'm not going to make this entire interview about myself.
That's a first. Yeah.
I do have some serious hip and knee issues. So I might need to figure out your schedule by the end of this. May need a hip replacement, but I'll let you be the one to diagnose all of that. Thank you for joining us. Like I said, OrthoVirginia is a proud, trusted orthopedic provider of Liberty Athletics. So Dr. Landy, we have a few questions for you. Let's start with a little bit of your background though. Why did you get into the medical field and why did you specifically focus on the hip and knee?
That's a great question. So, in medical school, you're exposed to a lot of different specialties and a lot of different ways to take care of patients. And I think when you go into med school, everyone's really interested in taking care of people who are sick and sometimes people who are really sick. And then the further you get in, I think some of us realize that there's a lot more satisfaction in maybe keeping people healthy. And instead of just focusing on helping people live longer, kind of helping them live better. And so that's one of the really unique things about a lot of orthopedic surgery, and especially managing sort of chronic hip and knee conditions is really about quality of life more than just quantity. And so that was ultimately kind of how I ended up going down the route to do hip and knee replacement.
I'm curious, obviously we work around athletes all the time, and you see, athletes now at a younger and younger age are doing very sport-specific training, and whether it's weight training or speed and things like that. Do you feel like, are there more knee injuries in younger people now than there used to be because of that? Is that something that you see, or am I completely wrong on that?
No, there do seem to be more injuries in younger patients now. You know how directly that's linked to this sort of early sports subspecialization, I think is a topic where there might be different opinions, but certainly we see more injuries earlier. And there's also, in addition to the age component, there's really a gender sex component to it, where especially for younger girl athletes, we see more injuries.
Interesting.
Wow, that is so interesting. Why do you think that?
Some of it probably has to do with muscle strengthening and conditioning, and a little bit with some variation in just the anthropomorphic, or sort of like the way we're shaped, kind of. That probably
I was going to say, Dr. Landy, you're going to have to explain that. I don't know those kind of big words. Can I just stop for a second? Matt uses big words all the time.
I am 100% confident that is the first time in the 5 years we've done this that anthropomorphic has ever been used.
So, I wouldn't even be able to repeat it.
Yeah. So, I mean, there's in medicine, sometimes there's a lot of fancy terms so that there can be more polite ways to say things. But essentially, men and women are shaped differently, right? Men are going to be taller on average. Women are going to have wider hips. But then when you think about the knee and when you think about the muscles in the front of your thigh and how they're going to control your kneecap, if you're shorter and you're wider, the angle that's going to take down to your kneecap is going to be different.
I'm just taking notes.
And so some of these factors are going to then be relevant. And when you think especially about the increased, which is awesome for so many reasons, that we see more girls in sports, but you think about soccer and some of these sports where there's a lot of pivoting, and then you think about the ability for the quad muscle to control and stabilize the knee, it's probably not going to be the same for a girl as it is for a boy.
That's a great point, because you think 50 years ago, like girls in sports, they're not at the level that they are now. Like there's been such a growth in that. That would probably account for a lot of those injuries like you're talking about that we didn't see 40, 50 years ago.
Yeah. And we also are probably better at diagnosing things, and people are probably more aware of what's going on, and they probably more frequently present. A lot of the patients I see who are now in their 70s, there are a fair number of them who had an ACL tear and then over the course of decades developed arthritis that has more of an ACL deficient pattern. And when you talk to them, you're like, when did you tear your ACL? They're like, I don't know. And you're like, well, did you ever have like a really bad injury? And they'll be like, when I was like 24, I was in this accident and my knee got really big and I couldn't really move it for a few weeks. And it's like, you probably tore your ACL.
Back then, we just rub a little dirt on it, get back out there. That was it,
Dr. Landy, what have you learned in terms of prevention with these injuries? I'm sure that's something that before you get to the point of surgery? What have you learned of preventing, the knee injuries?
Yeah, so I kind of break that down into maybe two things to talk about. One is preventing injury in younger, sort of more active patients. I think that has a lot to do with maintaining adequate muscle strength before you go to do these more advanced activities. And then second, warming up. Not especially like, you're 38, you get out to the basketball court and you just want to go.
Did she to give you this stuff beforehand? Like, wait, this is sounding awfully specific.
He's not in his 30s anymore, but Matt Warner just thinks he can get out there on the basketball court. And
I always say, do you ever see a cheetah stretch before he goes after the gazelle? No, you don't. You just hit it. You just go after it. No, I'm learning.
Do not follow that.
No, it's not all just about stretching, but it's about trying to warm up and start to engage the muscles before you go full steam, right? The first few minutes of easing into the activity, not at full intensity, the muscles literally start to warm up. You get increased blood flow to that area. And then it's probably going to help, not completely prevent, but help reduce your risk of having an injury. I think the second thing on this sort of injury prevention is not necessarily injury prevention, but symptom control. So when we think about older patients with arthritis, especially knee arthritis, right, strengthening the muscles around your knee or around your hip or your shoulder, it's not going to change the biology. It's not going to change the arthritis that you have in the joint, but stabilizing the joint can reduce the symptoms from the same level of arthritis. And I think that's one of the things that patients sometimes struggle with. There's like, oh, well, it's going to hurt me to do physical therapy or to do these things to regain some strength. And it's like, well, there might be a little bit of a short-term discomfort, but there can be a huge benefit for folks.
And what are some of the risks if you are pushing through that knee pain?
It depends on if you have an injury, there's a risk of re-injury or sort of exacerbating or making the injury even worse. But I think for things that are more chronic, there's probably not a lot other than just increasing your symptoms and not enjoying it.
Right.
It seems like athletes are getting back faster from knee injuries. It used to be like, as a kid, I felt like ACL tear, well, you might never see this guy again. What kind of advancements have allowed that, if that is the case?
Yeah, that's a great point. Some of it may be a little bit related to surgical techniques and things like that, though honestly, it's probably less that and more the rehabilitation and standardizing things and just people getting more aggressive and sort of pushing the envelope. And it's a little bit of a risk benefit, right? If you go back early, you may be going back with a slightly higher risk of a re-rupture.
That's so interesting. What have you learned in your time that is surprising the most, or maybe it's with the recovery that you've seen so much?
Like just growth within the field of people being able to bounce back faster.
I think, especially around hip and knee replacement, but even some of the other surgeries, I think we went through a period probably in the 80s and 90s where people were just trying to figure out, like, how do you successfully complete the surgery? Like, what are the technical factors? Like, what do you need to do for this thing to actually work? And then I think as we got into the 2000s and certainly over the last decade, I don't think there's been as much change in surgical technique as there has been changes in how we work with other people on our team, with physical therapists, with trainers, and how we, in anesthesiology and blocks, and how we do all of the management around the surgery. And that is hugely important. It's not just the surgeon, oh, I'm going to show up for 1 hour and we're going to do this, and then that's going to make the difference. It's like, that's a prerequisite, but all of these other things are super important. And I think over the last 10 years, and hopefully over the next 10 years, we get better and better at that aspect of kind of coordinating the care.
Yeah, I hope so too, Dr. Landy.
Yeah. Well, Dr. Landy, I want to know, I saw that you threw out the first pitch at a Liberty baseball game earlier this year.
Okay.
Is that correct?
I did. Yes.
I need to know, did you go from the rubber? Did you climb up on the mound and throw, and did you deliver a strike?
So did not climb up on the rubber. I think they probably did not want that. I would say it was close to a strike.
Okay. All right, good.
I'd also say it's a beautiful stadium.
It is.
Right? Like such a nice place to go watch a game.
Yeah, good. Well, I just want to check on that. Glad you didn't bounce it in there or something. That's what everybody tries to avoid.
Okay, it's warming up outside, Dr. Landy. So tell us how summer heat and humidity can impact one's risk of knee injuries. That's interesting.
Yeah.
Is that correlate?
I think there's not a huge correlation directly with the temperature, but I think what you do see, I mean, certainly people can be dehydrated and have issues from that. But I think the bigger thing is, especially in parts of the country where it gets really cold during the winter, right?
Yeah.
Is people get deconditioned. And as we get older, we don't always appreciate how quickly you can lose muscle mass and muscle strength. And then all of a sudden it's a beautiful day and you go outside and you want to do these things and you see this change in activity.
Yeah.
Right.
And so, I think there is a thing where there's more injuries in patients and in people this time of year. I'm not sure it's necessarily the heat as much as it's you haven't done anything and now all of a sudden you want to go hike 3 miles.
You get out there in the warm weather, you start feeling good. You just want to, you cut it loose.
So Dr. Landy, we saved you from the third member of our podcast. His name is Joe.
Yeah.
And we've been trying to get him to run a mile for the last
years.
probably 3 years.
He is much older than we are.
Yes, much older. I mean, we're talking a decade. Yeah. So we're gonna need to send this. He needs to listen to this. I mean, I think there's a lot more.
You guys should have him warm up and maybe train. You think about it. Oh, like when you're young, a mile is nothing. But I don't know if I could go out and run a mile. Right? That's like a long time.
Dr. Landy, originally he said he can run a 6-minute mile. And
he's
I'm like,
also delusional.
And we need to point out that the Flames did have a comeback win over Duke in the game.
I don't know throughout the first pitch. So they may have to have you back.
No, they've got a big weekend coming up here.
Yep, that's right. Well, listen, Doc, you kind of think of you, tell me if this is accurate, like a kicker. Nobody wants to have to use the kicker, but when you need one, boy, you'd better have a good one. Is that an accurate way to kind of describe, like, listen, you may not want to see me, but when you need me, I'm your guy. I know what I'm doing here.
I would say that's fair. I don't think many hip and knee replacement surgeons want to think of themselves like that, but that's probably not inaccurate. Yeah.
That's awesome. Well, we're so lucky to have you here
Absolutely.
in Lynchburg. So happy that you're a part of Liberty Athletics and OrthoVirginia, that partnership. We really appreciate your time. Remember, OrthoVirginia treats muscle, bone, back, and joint pains and strains. You can visit OrthoVirginia.com to schedule an appointment. I'm already
She's getting online.
on the internet doing that with Dr. Landy. Thank you so much again for your time.
Thank you. We appreciate it.
Thank you, guys. Thank you.